That being said, though, look out the window. There's not a single person out there crawling on all fours. Very rare. So, so, so the reality is that, I mean, you can blame God, you can blame bipedalism, or you can blame age. But the end point is you don't have to live in pain. And I think if there's one message that I can transmit to your amazing audience, it's that there's no such thing as normal pain. There's no such thing as normal back pain. If you live in pain, then there's something wrong. And it doesn't mean it's something catastrophic. It means that you're like everybody else. Something is wrong and your body's telling you so.
So good. Let's talk about the old way versus the new way. Traditional surgery strips the muscle off the bone. You use a keyhole approach. Can you explain to the layperson who's saving the muscle, or who is saying the muscle is the difference between recovering and suffering?
That's a big difference, huge difference, especially because not only is the morbidity lower when you don't cut stuff, when you don't, you can also do things that you wouldn't be able to do otherwise. Because look, your spine's in the middle of the body. There's organs all around, and then there's muscles and nerves in the back. It's hard to get to your spine without making a really, really big hole. Sometimes it's impossible to expose a large segment. For example, you go behind the kidney or you're behind the diaphragm. Big, wide open exposure still doesn't mean that you're gonna have good access. Now put a tube. I can operate on somebody who's obese. It's a tube, so I'll use a longer tube. In the end, I can bypass all the fat, I can bypass all the soft tissues and still arrive at where I need to go. But there's even more. And I can't really take that step with you until I give you a 2-sentence preamble, which is one, where does pain actually come from? So I'm really big into that. You know, you come to me in pain, I have back pain. You need a diagnosis. It's not enough to say back pain. It's not enough to even say it's L4-5. Which is the problem? Is it the disc or is it the joint? I'm not trying to overcomplicate it. But the second part of the preamble is we got to listen to the old experienced guys that run the educational bodies, like in every profession. In my world, it's called AAOS, American Academy of Orthopedic Surgeons. And these guys, using great biomechanical data, great studies, have concluded clearly that if you want to cure someone of back pain, you have to restore their sagittal balance. It sounds real scientific, but really it's very simple. You got to make it so that the person's head goes back to being on top of their butt. As we get older, we start to lean forwards. We get into what's called kyphosis. You got to go back to where your head is above your butt, but you can't get there because the front of your spine, the discs have gotten short. So the American Academy said that restoration of sagittal balance is most associated with back pain relief, meaning that, surgeon, I have to give you back your height. I have to make you taller. And I'm not talking about leg lengthening stuff. I'm talking about sneaking in, removing the remnant of the disc and replacing it with a much taller device, either a fusion device, if there's deformity, or a disc replacement, if there's just disc degeneration. This way you keep your motion and you get your height back, you place your head back on top of the butt, you restore the balance, voila, the back pain is gone. So, back to your question, how is minimally invasive better? It's not just better, you can't get there with classic surgery. Classic surgery, straight down, you can't restore the height. If you distract, you pull across the bones and put screws and rods, the bones just won't knit together. In order to get the bones to knit together, you got to compress them. So from the beginning, in the best of hands, you go from the back, you're going to have a 36% failure rate.